My name is Emilia DaSilva-Tavarez. I am the Workplace Psychological Safety Act Director in Rhode Island, and I'm testifying in support of S2473, the Workplace Psychological Safety Act. Let's talk healthcare and taxpayers. Nothing to address the problem doesn't only affect marginalized groups. It also harms all taxpayers. Employers externalize healthcare costs when they ignore employee well-being internally. When abused targets leave unhealthy work environments, they become burdens of taxpayers. Their work environment, they're frequently uninsured, and when they get sick, they turn to ERs for care, where delivering primary care is not cost efficient. By the time they get there, their health has already deteriorated to a point where treatment expenses are far greater than earlier intervention would have been. This bill would incentivize employers to address employee well-being internally and not make it a public problem. Back up those problems. In his book, Dying for a Paycheck, Stanford professor Jeffrey Pfeiffer says, the United States experiences about 59,000 excess deaths and about $63 billion in incremental costs annually compared to what we would be predicted given its per capita income level. Considering the total toll previously estimated of about 120,000 excess death and 180 billion in costs, our analysis indicate that about half of the deaths and about a third of the incremental costs from workplace conditions appear to be potentially preventable if the United States were more similar to other advanced industrialized economies. Prevention is both less expensive and more effective than remediation. We have environmental regulations to limit environmental risks. We don't mention the human impact of abuse. We don't leave environmental pollution to discretion of CEOs. So why do we leave health up to the CEOs, when CEOs too often lead in ways that serve neither the employees nor the public nor themselves, when you include the hidden costs of turnover and absenteeism? The U.S. is the last among all Western industrialized nations to acknowledge workplace abuse adequately. As a civilized society, there ought to be limits on what companies can do to their people. We should prohibit companies from psychologically abusing workers. Every session, we don't act. We leave employees and employers to suffer and healthcare costs to soar.
Can I bother you to finish up, please?
Inactions cost lives, damages in the Rhode Island economy. A safe workplace benefits not only employees, but the public and also businesses in Rhode Island. Please use your power as legislators to save lives and move forward S2473, the Workplace Psychological Safety Act.